this on the
Okay. Excuse me. Our case for change is that the U.S. should adopt nationwide the Oregon's model for physician-assisted suicide. Our significance claim is that the pain and suffering can be unremitting in certain cases with hospice care, and physician-assisted suicide is the only way for that pain to end. Our inherency claim is that the Hippocratic Oath permits death by physician-assisted suicide, and that multiple state laws are in support of it. Our solvency is that the issue of a Kevorkian-like situation is false. R.J. Cassell in the New England Journal of Medicine stated, "I have assisted many patients to die with their full consent. None of them wanted to die. All would have chosen other paths, and had their disease not been so severe and irreversible, to a person none of these patients thought of themselves as suicidal, and they would have found that label preposterous and demeaning. In fact, the kind of personal disintegration that the label implies is just what is trying to be prevented by those choosing this possibility." Palliative care in the United States, only about 30% of dying patients ever make it onto hospice, and for some of those 30%, the referral is made for the last hours or days of life, and that was published in an article, Understanding Hospice, an Underutilized Option for Life's Final Chapter in the New England Journal of Medicine. In addition to the low number of patients that make it onto hospice, most clinicians have not had adequate training in palliative care, and it is unevenly available, and an insufficient number of trained subspecialists meet the needs. In extreme situations, physician-assisted suicide provides 5 ethical criteria that make it acceptable. The physical or emotional symptoms of the person's illness are unbearable and are so bad that they are not treatable. The patient lacks a solid network of psychological support that can be comforting. The prognosis is accuracy, and every consideration has been made, including a second opinion to verify the diagnosis, and no mistakes have been made. The degree of the patient's understanding. The patient understands the disease, its present state, and its expected course. Oregon state laws statute specifies that participation in the act is not suicide, and so should not affect insurance benefits by that definition. There are approximately 5,000 to 25,000 patients that have a distinct dying process with significant and unremitting pain that desire desire physician-assisted suicide and are confident enough to request the service. In regards to the Hippocratic Oath, the medical ethos is not restricted to healing, and palliative care falls outside of this. For example, the do no harm. Fertility is not regarded as a disease, yet contraceptive pills are prescribed and not to heal. Physicians are required to provide care in accordance with the personal goals and values of the patient, which is fundamental for the doctor-patient relationship. And in extreme cases of unbearable suffering, a patient who seeks physician-assisted suicide should be able to relieve the suffering through a compassionate physician who is willing to prescribe lethal medication. Dr. Kevorkian, a lot of fear comes from, when it comes to physician-assisted suicide, comes from Dr. Kevorkian, who in 1998 recorded himself giving a lethal injection to a gentleman who had Lou Gehrig's disease. For 10 years before that, it had been known that Kevorkian was assisting with physician-assisted suicide. What he had done is he had created a machine that administered a narcotic, and then after a lethal dose of potassium, he wasn't directly involved in the killing, but he got in trouble and has a bad reputation because he actually injected a lethal dose to the gentleman with Lou Gehrig's disease. The laws in Oregon are specifically against that. The medication has to be self-administered. It cannot be administered from anybody else, and there are safeguards in place to prevent abuses of this, as such with Dr. Kevorkian injecting the lethal dose to his patient. So, because of the various safeguards and the ability to relieve unremitting pain and suffering, physician-assisted suicide should be legal nationwide.